It's crazy to think that a nursing home resident can get injured while being pushed around in a wheelchair, but it happens more often than you think, and the reason why should get you upset. My name is Barry Doyle, and I'm a lawyer handling nursing home abuse and neglect cases throughout the state of Illinois. A wheelchair seems like one of the simplest devices in a nursing home, but they've been the source of some of the most frustrating injuries I've seen in my practice. How does this happen? Well, you have a resident seated in a wheelchair and they're being pushed along by a staff member without the footrests in place, and the resident's feet get stuck on the floor, and one of two things happens. One, their legs get pulled underneath the wheelchair, resulting in a twisting motion that causes fractures to the legs or injuries to the ligaments and cartilage in the knee. Two, they get catapulted forward out of the chair, causing fractures or head injuries when they hit the floor. Simple, preventable injuries. All that has to be done is to put the footrests on when pushing someone in a wheelchair. The real question is, why don't the staff do that? Why do these accidents happen? In the end, I believe it all comes down to decisions made by management. Either the staff doesn't know that this is something that needs to be done for the safety of the residents and doesn't know about the risks that they're running by not putting on the footrests. And if that's the case, it's an issue of not training the staff, not investing in people, which is a choice. Or they knew they should use footrests and chose not to do it. Anytime you see a nursing home staff member take a shortcut, that's a sign of an understaffed nursing home. They simply don't have the time to do things the way they should be done. There are so many residents with so many needs, but so few people to care for them that things just don't get done the way they should. So the net result, a simple step like putting on the footrests, gets skipped. And here's the thing. That isn't the first time that shortcut's been taken. They've been doing that time after time with resident after resident, and they get away with it, and they get away with it until they don't. And then the one who pays the price for that gamble gone bad is your mother or father. This is the sort of thing, taking shortcuts in care, that happens all the time. Residents who don't get turned and repositioned or changed promptly, setting the stage for getting bed sores. One person instead of two operates a lift, and a resident gets dropped. Time after time, these things happen, and they're the product of decisions made by management about how to staff the nursing home. It's a choice, not an accident. And if you think this has been interesting, check out this one here.